Yeah. I know for fertilizer, it's not for the.
Yeah. Okay, well, we'll call the meeting to order. They say we're on, I have no idea. It's like computer knowledge. Um. Public comment? You don't want to listen to her. I've been anyhow.
Just here because we have a great presentation coming up.
Okay.
I'm really excited.
You have the camera tracking on.
You know,
Yeah, do you have both of the,
Or both of them. There's the two ones, right?
yeah, there's two separate. Okay,
But then,
this guy's missing.
okay,
So this, he goes right in
Perfect.
here. Yep, and then it should,
you know,
whatever. And it should. And then you might have to change the input on the cameras.
Backwards. Great seat, you're off camera.
Yeah. Good. I don't want to break the game. I'll approve the minutes first.
Yeah.
Motion to approve the minutes. Move.
Second.
Discussion. All in favor, say aye. Aye. Opposed? Carried. Unless anybody has any problems, we're gonna try to schedule a little bit today. Do you have any concern?
Right. So at 9:15, we'll get started with the public participation piece of the meeting. Until then, we'll jump ahead to approval of the vouchers and out-of-county travel request. For our July out-of-county, we have several meetings and a couple conferences for public health, ADRC, economic support, child support, and then Chris and I for CC, an annual meeting in Menominee. So that is what I'll send around for our out-of-county for July. Want to see the invoice? Did you look at them or?
There's nobody on, sir. Is that,
Because they're scanned in. If we give them
well,
all-
they can still see. Is anybody wanting to watch it?
Doesn't look like anyone's on.
Anybody on?
Up to you. Want to look at them or?
She's got it.
Okay.
I looked at it briefly on the computer online.
Okay. Then we'll go ahead and look at some vouchers. There was quite a few pages this month. Kind of all standard, starting off with our insurer, which is the Abbott Laboratories for ADRC. It's what we sell outright at reception upstairs. All these access charges are Aurora, that's for CSP, and some jail education groups that happen. Action City, I know people are gonna question that. That's CLTS, Children's Long-Term Support for the families with kiddos with disabilities. Amazon, several of those, more children's long-term support, therapeutic supplies. There's one on here for a mattress and a bed frame that for a foster kiddo that we were moving from a residential placement into home, family home. Anybody has any questions? Or I'm just gonna kind of roll through this. There's a couple Amazon charges for like Deep Woods towelettes. Our public health department made those tip kits again, so they had to buy more supplies for the tip kits that they leave around the community and promote. We'll go to page 2. Several more Amazon charges. Most of those are children's long-term support, therapeutic supplies. 3/4 of the way down, there is a WIC breast pump that we needed to replace a piece for, so public health loans those out to families, and this piece happened to be broken, so we needed to replace that. For those families, we use those, breast pumps and more supplies for public health, gauze, sponges, laminate sheets, things like that. Page 3, unless anybody has any more questions on page 2. I am. Got my color coding too. All right, going to page 3, Anchor Bay Counseling. There's 4 different charges on there. That is our CCS supervision for Michelle Rail, and then she also comes in and does our mobile crisis assessment reviews and CCS supervision. So there's 4 different ones there. More children's long-term support. That was a CCOP for the Children's Museum. There's some out-of-home care costs there, foster home, subsidized guardianship and kinship. CISA 10 is our Birth to Free program. And then almost all the way down, that Chris Mark Home LLC, those are adult service placements. And City of Eau Claire, the sterility verification, I had a question on that because I didn't know what that means. We have to send our testing bottles for our water testing there to make sure that they're, I didn't know that, so I learned that. The civic system at $1,434.50 for HSFMS. Both our CLTS program uses that, and then top of page 4, our adult service system also uses that. So that's on page 4. Any other questions on page 3? We didn't have a lot of time. All right. On page 4. Commercial testing lab. That was our water testing. We had this, I'm not sure how I say it, but the Cool system commercial. There was a $2,000 charge and then a $360 charge. We had to have a cooler repaired out at the senior center. So that was the cost of that repair. Okay, halfway down, we have eSmart. That was some ice for the senior center. Family Farms, again, that's for the senior center. Flambeau Mountain Printing, some business cards and some notepads. Forensic Fluids, when we have special requests for confirmation regarding like CBD, Delta 8, Delta 9, there's an additional charge to verify what's in those drug screens. So those were those costs there. The Forward Health charge here for $730. Our public health department needs to update their NPI number every 3 years for MA. So we had to pay for that. Front Point, that's security systems that is provided by Children's Long-Term Support Program. Almost like to the bottom, 3 rows up, Holiday Inn, that was a hotel stay in Minnesota for Amanda in public health. She went to CPR training. She can be a certified instructor. Any questions on page 4?
Is the Front Point, is that could be a monthly charge or is that an annual charge?
And that's primarily used for kiddos who are low pain and things like that. All right, page 5. Finishing up the Kalahari from last month that we had a ton of, but there's a couple more finishing up over there. Costner Law, you know, that is rich for child support. We have more out-of-home care, kinship reimbursements there. Quick Trip cards, we had purchased some gas cards for some families that Children and Family Services are working with out of our Safe and Stable grant. Ladysmith News, printing of the source, and also posting the vacancy of the citizen board member, that charges on there as well. Ladysmith Postmaster, that's for postage. That's a breakdown of the postage for each department. Little Sprouts Childcare Center. That was kind of an emergency situation where we had to place with a family member and they didn't have daycare services, so we had to pay for that. Otherwise, that placement was not going to happen. So that is what those two charges are for, was to help a provider. So we didn't have to put those kiddos
Where is that?
someplace else.
Sprouts.
Sure.
It's Triple County. The home was in Bloomer, so I think it was like within 15 minutes of their home. Now, that's just a one-time one because they went to a certified daycare the next month.
And then some more kinship care payments on the bottom. Any questions on page 5? All right, moving on to page 6. Except that there was a lot of this one. All right. Full disclosure, the first one on page 6 is Northern Paws Pet Lodge. That was us paying for the cat boarding for some fire victims. That's what that is for. Trying to work with Salvation Army and some other agencies to get reimbursed for that. That hasn't happened yet, but that is what that charge came from with the cat. So those ladies could leave the shelter. We could close the shelter up. And that was me. All right, Pana Gold, that's more food for the center. We have some veteran service charges on here for some flags. Trying to think if anything else just kind of stands out here. Rosa, again, she's our interpreter. Rusk County Transit, so for some veteran services, transportation. Tammy helps vets get to medical appointments if they don't have insurance or a mechanism to do so. And then the last several charges are staff works. That's through the ADRC. Those are the in-home services for individuals who are elderly and disabled who need extra help in their home. Caregivers come in to help them. Any questions on page 6? Open it up.
Got 2 minutes.
Page 7. All right, the top of that is staff works, the same thing. Support in the home. Stericycle, those are, the safe disposal of those needles. Sunlight assisted living, halfway down, that's adult services placements. The Cisco charges are for the center, food for the center. The last 3. There are out-of-home care costs that Tomorrow's Children, he was discharged in June, so that payment is going to stop. I think we'll have maybe one more that's a less amount, but then it'll, fingers crossed, we won't have that again. Any questions on page 7? Page 8, Trimble County, or adult service placements. Then we have several Verizon charges. Those are for all of the cell phones in the department, broke down for the 7 departments. Walmart charges, we have them divided up between public health and senior services. Questions on page 8?
Yeah, are we renting all the centers?
So if we pay the villages for the use of
Like the one
things.
Sheldon. I've only seen the one,
I think every year they kind of negotiate
like a yearly charge. It's a yearly charge.
I believe so. All right, then we'll go page 9, last page. Department of Justice, those are several background checks that we have to run in children and family. And there's a senior center or senior services background check too. In the Department of Transportation, we use some grant funding to help an individual gain their license back. That was a placement, so they could transport that kiddo to the necessary appointments.
To approve?
We'll move.
All in favor, say aye. Since it's now.
Yeah.
9:16, we will declare. Public participation open.
So this is my first time doing this, obviously. So I wasn't quite sure how it was supposed to be done. So I decided that I was going to do a PowerPoint to hit all the topics we're supposed to talk about per the statute. So one thing I do want to talk about before I get into the PowerPoint though,
Okay.
is I took the time and worked with several staff and managers and updated all of our programs offered sheets. So I know that you guys are probably very familiar with the front and back one we had that lists all 7 departments in just like a bullet point of the services that are offered in each department. I felt that it was going to be beneficial for our consumers if it was more detailed, because most people don't know all of the services that we offer in human service, in health and human services per department. So on the table there, all 7 departments have their own sheet talking about what services are provided and child support specific, what services are not provided. Like filing restraining orders, that's taking things back into court for custody revisions, like that's stuff that they don't do. So I wanted that on there as well, because that's a frequent question that clients have when they come in and call. So all of those are updated. I had Rhonda print them each in pretty colors so everybody can have them. So those are updated, and it is a really thorough breakdown of each department and what they do and a description of all of the programs in that department. So that is in the packet too. You guys don't have the pretty colors, yours are just plain old white, but they are in the packet if you guys want to review those. But I think soon I'm gonna put them out somewhere. I want to put them out in our waiting room. I need a stand, but we'll figure that out. That is the next step for these updated programs offered sheets. So the purpose of this meeting is it is statutorily required 46.0313 county departments of social service, chapter 51 and human service department agencies have to have this meeting every year. It is supposed to happen before July 1st, which I did not know. However, I did email the state and said, hey, our meeting is July 10th. And they said, as long as I let them know, we're completely in compliance. So there's no question that this meeting is happening on the 10th. So I want to highlight the 7 departments in health and human services. You have adult services and disability resource center, child support, children and family services, economic support, public health, and our veteran services. As of 7/7, HHS has 63 employees. 42 of them are full-time and 21 are part-time. So that is a breakdown for the part-time. There's 3 individuals that are part-time that work in our public health department, and the rest of them work for our senior services. They're the drivers and the cooks. So adult services, what adult services offers is CCS, Adult Protective Services, CSP program. They offer case management for individuals who just need some support. And we have crisis services. And they will also help locate detox services, inpatient psychiatric services, intoxicated drivers program, outpatient AODA and or mental health services, and residential treatment if that individual needs that assistance. Our adult services department has 3 individuals that work in there full time. I get my sheet because I don't want to forget how many people work in what department. All right, our ADRC. And I actually had a little bit of fun learning about this because there's a lot of programs that our ADRC offers, and I don't think a lot of individuals are aware of that. Our ADRC staff here, we have 6 full-time And then, like I said, the senior center has most of them, part-timers, 18 of them. Nutrition programs, we have the Meals on Wheels program, the nutrition supplement drinks where people can come up to DHHS and we will sell them a case of Ensure or Ensure Plus at cost. It's cheaper than going to Walmart and things like that. But if you come up, we have vanilla and chocolate and pay for it and go about your day. The commodity supplemental program, this is also advertised in the source, but individuals who qualify can get a box of food like peas, peanut butter, things like that. So you can come in and sign up for that with Kathy. Our senior dining, so that's coming into the meal sites, are dining at 5. And then all of those nutrition programs, there's a suggested donation other than the Ensure, that's a flat rate for that. The aging and disability services, they offer memory screens. We have a loan closet where we have lots of different supplies available. Walkers, beans, things like that, if people need them. Screening and counseling, and application assistance for public and private benefits. They will help you locate information and resources, helping with disability applications. They'll talk to you about Medicare and other insurances that are available. And if there's any home safety modifications and adaptive equipment that you may need, they can help you locate those resources. They can also help you with the short-term and long-term care, enrolling into long-term care, healthy living programs, fall prevention workshops. Kathy does a really good job at advertising all of those things. Locating in-home assistants and providers, like our staff works on our vouchers, individuals coming in to help people in their home. That's part of that. Caregiver support and programs, and then trying to help with housing, including senior and low-income housing options. This is our child support. They will work with you on enforcing child, family, and medical support orders, establishing child and medical support orders, establishing paternity, locating parents who are absent from the home, modify and review existing child support orders, and interstate enforcement if somebody comes here from another state. And like I said earlier, services not provided, custody or placement concerns, establishing or enforcing a spousal only support order, filing restraining orders, filing divorce papers, or terminating parental rights. That's services that they do not work with or help with in child support. Children and Family Services. Oh, I want to go back. Child support has 3 staff. That's it, sorry. Children and Family Services, we have 10 full-time staff in Children and Family Services between all of these programs. Child protection, youth justice, foster care licensing, kinship care, coordinated services team, which is our CST team. And Cheyenne is in charge of foster care, kinship care, and our CST. So she's here. Thank you, Shy, for running those 3 programs. Comprehensive Community Services, CCS, and Children's Long-Term Support. CLTS, Cheyenne also does functional screens for CLTS and CCS for kiddos. So thank you, Cheyenne, for wearing many hats in our Children and Family unit.
Follow up on that CLTS in Eau Claire.
Yeah.
There were a couple articles in the last, I don't get the paper all the time. The last one was an actual county board member, must be on Human Services Board or whatever they have there, and wrote a very nice letter about it. And so hopefully it all died down.
To kind of like rebut what that other lady was saying.
Yeah.
That's good though, because if you don't know.
Yeah.
Yeah. All right. Economic support. We have 5 full-time staff in our economic support unit. They help individuals with food share, medical assistance and Medicaid, childcare subsidy program, caretaker supplement, Wisconsin Home Energy Assistance Program. So our WEAP program, Central Data Processing Unit, CDPU. And I had no idea what that meant. I had to call Heather and was like, what does this mean? If individuals need paperwork scanned in and uploaded into their case with the state, we do that at our reception. So if anybody needs help getting their documents turned in, we will help them with that. That's what that means. And then childcare certification. Public Health Department, Kaylee's here in case I mess anything up. Full-time, we have 4 full-time staff in public health and 3 part-time staff. Public health offers a array of services, including birth to 3, car seat safety checks, communicable disease, that's a hard one, dental services, DNR transient non-community well program. There's a mouthful in all this. And if you have any questions on any of these, there is a breakdown on those sheets that tell exactly what all of these programs are and what they do and population that they serve. Environmental health and human health hazards, food safety and recreational licensing, immunizations, lead poisoning prevention, maternal child health, Narcan Direct program, public health preparedness, reproductive health, and our water lab, and then our WIC department. And then coming soon, Kaylee and I are really excited about the CPR classes that are going to be offered, and the babysitting classes and mental health first aid. And I believe, Kaylee, you're going to be teaching the mental health first aid classes starting in August.
That's correct.
Awesome. And veteran services, so we have kind of the one-woman show in veteran services with Tammy. Jerry does help her with some things, but Tammy will help vets in acquiring federal and state benefits, assisting and advocating for any of the following issues: medical, financial, compensation, pension, death and burial benefits, and education benefits. And she will work with other agencies and services. If that vet actually needs those services, she will work with partnering agencies to get that vet whatever they need to be successful. So meeting with Tanya, this is our 2025 approved budget, $6,212,202. That is total HHS budget. Then we did a breakdown of each department. And our levy ask was 1.6. So the reason I say that is because going into 2026 with our out-of-home care and mental health crisis, that might be going up in 2026. So that's why I'm sharing what 2025 is. So some confusion in services for HHS. I know there's been chatter about HHS costs a lot of money. You are high dollar amounts. Why are you spending this much money on kids in placement and adults in placement? We have to. We are obligated by statute to pay for any kids in out-of-home care, adults in out-of-home care. We're responsible for people going to the hospital. So I thought it would be beneficial to highlight what services we are required to provide. These are not optional. So when we get that bill, it's not a question as to like, well, why are you doing that? It's because we have to. So child protection and child welfare services. So that is guided 100% by Chapter 48. We are required to provide those services 24/7, 365. Placement and other related costs are unpredictable, and counties are responsible for paying for children in foster care or residential facilities, which we've seen. We've had 2 kids this year that were in residential facilities at Lad Lake Placement and then the Tomorrow's Children. So we are required to do that. Also, youth justice, that is driven by Chapter 938. Again, we are required to provide juvenile intake services 24/7, 365. I'm gonna knock on wood. We've been very fortunate where we haven't had to send any youth to like juvenile correction, like Lincoln Hills. We haven't had to do that. But if that were to happen, that would be on our dime, and that's very, very costly. So if it does happen in the future, it's required, but we've been fortunate where we haven't had to do that. Our children's long-term support program, I know you see all the CLTS charges for the therapeutic supplies and the CCOP charges for kiddos, going to Action City or whatever. We have to provide our children's long-term support program. That is a Medicaid funded program. I want to highlight that currently we have 122 kids that are enrolled in that program. We have 2 staff. The average caseload in Wisconsin is about 30. We have somebody starting next Tuesday, so that'll put us up to 3. However, I would imagine in the next 6 months, I'm probably be coming to you asking for another CLTS worker because that caseload keeps climbing. But again, it is Medicaid funded. It's a service that we have to provide. It's a very beneficial service. I 100% believe that our children's long-term support program keeps kids out of residential facilities and in their homes and not in foster care placements or anything higher level than that. This is a very valuable program for our community.
Ashley, do you have any idea that 122 children? Break that down, how many families would that? Because I would imagine you got a few families that have 2 or 3 or
Yeah,
whatever.
I
and
mean,
Just, don't have to be accurate, just to.
I do the screening and typically most of them have 2 to 3. If some of them have 5 or 6. I know that like right now I have 10 referrals from the last like 3 weeks. So that number just continues to grow. And typically once one child gets enrolled, then you see other kids in the home.
I'll look that up though for meeting.
I'm just curious, so.
I'd probably say that it's at least 2 to 3 kids per family that are enrolled.
I'll look it up though, and I can bring that back next.
That's totally funded by Medicaid?
Another employee would be funded by Medicaid?
And we need it. I'm just gonna say Michelle and Brittany are completely like overloaded right now. They're doing awesome. They are rock stars, but it's a lot of work because it's not just purchasing things. It's every 6 months they have to go into the home and they have a lot of paperwork that they have to fill out like every 6 months. And then they have to meet standards they have to have like one collateral contact a month, and you have to see them face to face every 2 months, and it all has to be documented. And I might be off on my.
And they get a lot of requests to go for like IEP meetings to like help support them, talk about services that they're like working with and such as well. So they offer a lot more than just
Yeah.
what's seen on paper.
Yeah, they offer a lot of just support.
Like even like the respite, just getting them connected and finding people that may be an option for them because some people don't have any natural supports.
And the CCOP that is parallel there to our CLTS program. Birth to 3. We are required to provide those services. And I checked. We have 16 kiddos in birth to 3 right now, which is fantastic. And child support services, that is required of us. And what did you tell me yesterday? 1,100 in some cases that you guys are handling between the 3 of them. So a lot of child support cases. And then we have public health. Most of the programs that public health offers is mandated. However, I will point out that not a ton of funding is supporting those programs. So again, lack of funding, but we still have to provide the services. Not gonna go into. And then we have to provide adult protective services, just like we have to provide child protective services. We have to provide mental health and substance abuse services and emergency crisis services. And I think everybody knows that we do in-house mobile crisis, our 8-team rotation. They deal with anything related to crisis, adult services, child protection, adult protection, mental health, AODA, youth justice. They respond 24/7, 365. If you call upstairs during the day, you're going to get our on-call worker. If anybody calls after hours, it goes through the sheriff's department and they're going to put you in touch with the on-call worker. Our on-call worker will respond here to the sheriff's department or to the hospital. They do a thorough assessment. They work with law enforcement and the medical providers to determine what is the best course of action for that individual for their safety. Can they go home under a safety plan, or is that not an option? Do they have to go to the hospital? Also have our economic support department, which is mandated services that we have to provide as well. And then these services are not statutorily required, but very valuable to this county. Our CCS program, we have 46 individuals enrolled total, 34 kids. So a lot of them are duly enrolled. So most of the children in CCS are also enrolled in children's long-term support. So they're getting 2 full services there. We have 12 adults in CCS. PSP, we have 17 adults. So those are adults with persistent mental illness living in our community. They're not placed anywhere. If we did not have this program, we could have a lot more individuals in Trempealeau or these group homes.
Or the minimum upstairs.
Yep, 100%. Or sitting in the jailhouse. Yeah, absolutely. And then also our aging services. The nutrition programs, I know it is costly to run these nutrition programs. However, they are valuable. Some of these individuals don't have much contact with, the outside world. If they have a delivery, that person is kind of doing a welfare check, making sure that they're okay. They're getting some social interaction as well. And then polling our staff yesterday, unmet needs for the county. We have mental health services, inpatient hospitals. Like there's just a lack of mental health services everywhere. It's not just us. But it does impact our budget. Sending people to Winnebago when we're frequently chaptering individuals, that adds up. And it not only adds up for us, but it adds up for our police department and our sheriff's department because they have to eat that cost of transportation. Like we have the placement cost, they have the transportation cost. And oftentimes the sheriff's department has to call somebody in to help with transport. So that not only are they paying for the time, they're getting overtime most of the time. So it's expensive all around. Unmet needs, again, CLTS, we're gonna need another worker here shortly. Lack of childcare facilities, lack of transportation, lack of housing. I don't have all the answers for these. I'm just citing what some of the unmet needs are in our county.
So in general, are we connected to like, let's, for example, the lady that wanders the streets and sleeps wherever? Those type of people, yeah, are we connected in some way to those?
Sometimes individuals in our community that are out and about and, causing people some alarm, we offer them services. But until something happens where we have legal jurisdiction, there's nothing that we can do. So, but the community calls, right? The community's like, hey, so-and-so is sleeping on the bench. Oftentimes law enforcement or one of our staff have already had contact talking about the resources like housing, maybe the shelter. Sometimes these people just don't want the help. They're just like, nope, I'm good, leave me alone. We can't make them do anything. Are they causing an issue? No, people just don't like to see people who are homeless sleeping on the bench. So that's kind of where we're at with that. But oftentimes, yes, if somebody's wandering around the community, we're getting those calls. Services are being offered to them, but they don't have to take them.
The first time, as long as I've been on this board, we have our legislators working on that mental health thing, trying to
Yeah.
get some of that money. But they're sure spending a lot of it down by Madison, but trying to get it up here is just ridiculous.
So whatever happened to that 125 million that they set aside?
For 15 million that was to go to Sacred
Was
Heart.
it 15?
Yeah.
Mhm.
Well, where did that go?
It disappeared because its timeline ran out to spend it. So now they're trying to put it back in again. But they want to do it for the hospitals, for the Chippewa Valley instead of the mental health was where it was started out to be for Sacred Heart to give us more space, which we definitely need.
Yeah.
What they're talking about now will be full the next day and we'll still have the same problem.
Well,
So
because everybody needs.
I haven't heard any more that they were introducing a bill to put it back out.
So that's my PowerPoint. Does anybody have any questions or comments?
I have a question to the audience.
The three that are out there?
Yeah. Considering that the changes for the contingency plan for the money we had in there that came through the county board, very little discussion. I think this would be another very good step to reinforce what we did, this presentation. I was surprised it passed unanimously and there was no arguments over it. Because we were the second highest or first highest? Can't remember which way it was. But I think this would be a very excellent thing for the whole county board to see.
PowerPoint?
Yeah. So we'll talk to Ashley audience. See if we can get that on the agenda somehow,
So,
whenever it can fit on, budget or agenda I've seen for this time isn't very big, so.
I think it's a good idea because there's a lot of people out there that have no idea what this is all about. And there's a lot of people out there that maybe even the board members would have relatives that are looking or need services and they don't know where to go. So I think it'd be
You can probably put all the non-colored sheets in the agenda when it gets emailed out.
Don't know about the services that are offered until they need it. And so that's a common thing that like when, especially on call, we're getting those things like, oh, I didn't realize that all this type of programming was offered.
a lot of times they don't even know to call. Number to call to start. That's what I find a lot of times.
Or to even just call a front desk and have the front desk refer them where they have to go. They're just,
Overall, like you hear that Russ County is very collaborative and that we like just with all of our community services and about how we have a no long door policy, that even if you don't know about the whole breakdown, at least you know like where you can direct someone. So that's something that you hear often is we have a very collaborative community.
A lot of good info.
Can you go into the committee folder and pull up the public participation? So when I reached out to another county, just to see kind of how they do it, she had sent me kind of a guide, and Jeremy had one too. So this is in your packet as well, the public participation planning process for 2026. And so what this is a complete breakdown of the meetings and the groups that our staff participates in. So over here, we have the frequency, so they're monthly meetings or bi-monthly, quarterly, annually. Just didn't know which. Yeah, please share. Because I just think that this highlights how involved our staff are in the community with the different organizations and everything that they're doing for outreach purposes. Here, she's my big person.
I won't start sharing that one.
You have to like stop.
I've stopped sharing and it won't stop sharing it.
Okay. I'll just go through it. quickly.
old-fashioned way.
Go through it so fast. It is in the packet. Anyway, we talk about all of the different groups. And basically what human services is. So the first thing that I have on here is Russ County Health and Human Services Board is comprised of 5 county board members and 4 citizen members. Talk about how frequently we meet and when we meet. Then we talk about CCS because a lot of these programs are required to have meetings on a regular basis. So between Chris and I, we are attending CCS meetings because we're part of the consortium. So there's director meetings, manager meetings, then there's like facilitator meetings. So CCS is very involved. Children and Family Services, along with Adult Services, meet monthly with members of law enforcement from the Ladysmith Police Department and members of the Russ County Sheriff's Office to discuss mobile crisis efforts to develop and maintain a supportive and collaborative working relationship. Talk about CJCC. I'm a part of that team as the director. It's required that I participate in that. That is a monthly meeting that we attend. RCYC, I believe Cheyenne attends that along with law enforcement and other community members. The Russ County Youth Council, that's what that.
That one too.
Oh, Kaylee does too, see?
Yeah.
We're all over the place. Aging and Disability Advisory Committee, they meet bi-monthly. Aging and Disability Resource Center Board meets quarterly. CCOP and our CST meetings, we have combined them. We've combined them because basically it's the same target group for for each committee. So we just hold them together and Cheyenne is in charge of those meetings. Behavioral Health Advisory Committee, I believe, Bill, you come to that one. Russ County Elder Abuse Interdisciplinary Team, the I-Team Caregiver Coalition. I think Mark, you're on some of those with PDC.
Yeah, the Aging Disability Resource Board meets every other month, not quarterly.
Okay. Yeah, I'll fix that.
Like-
Which one? The Aging Disability Advisory Committee?
Yeah.
That one.
Every even month, I think, basically.
Okay. Birth to 3 Advisory Committee, Veteran Service Commission. Talk about this public hearing that's supposed to happen annually. Keep going down. Our mobile crisis team meets every other week to discuss any issues that they're having with mobile crisis, maybe some clients that are frequently, hitting the crisis line, just to know what everybody is doing for those individuals. We have a crisis line that's available. All 7 departments are putting information out there. I know Kaylee has like a Facebook page and our ADRC has a Facebook page to get information out there. And then this big section here is a ton of meetings that everybody just participates in. I'm not going to go through them all, but just know that everybody's really busy and involved in a lot of things.
I think where the ADRC is quarterly, this is a nutrition meeting.
Okay,
There's a separate meeting every other.
I'll get with Kathy and that. That one.
A lot of information.
Do a lot of stuff. I know, I was surprised, I got with all the managers, not surprised everybody does anything, but like just all of the meetings on top of the jobs that they're already doing that they're participating in, so. This is all in the packet and it's,
I think it'd be a good idea when, after each election, when there's new board members, to give them a orientation, because I would bet the majority of them wouldn't know all the things that are happening, what's mandated, what's not.
I will absolutely meet with anybody who's curious about what we do. 100%. So that's what I have for that
Thank you.
page and information. We just get going the rest of the agendas then?
Sure. Go wherever you lead us.
Go wherever I'm good to go. So. Vouchers at travel. Yeah. Monthly budget report. Yes, monthly budget reports. So. This month is kind of the same as last month. The only budget that I'm really concerned about is our adult services budget. At this point, so it is on page 11 in the budget. And again, that is because of placements. We are projected to go over budget in adult services. Yeah, we could jump to her too. We jump to Amy.
Go for it.
Okay, new staff introduction. This is Amy. Want to tell us a little bit about yourself and what you're gonna be doing?
Sure, I am the new youth justice worker. I have been a certified social worker since 2007, worked with children and adults alike. Really excited to get into the youth justice position. Guess I don't know if you want to know anything else or. No,
Well, you can tell us about yourself,
I live in Carat, between Carat and Cornell, actually, about 6 miles from Cornell. I have 6 children of my own. They range from 8 to 20. And I guess fun fact, I'm teaching horseback riding lessons on weekends. So. About all I got.
Thank you for
Thank you.
coming down. You guys want to introduce yourselves to Amy? You want to introduce yourself to Amy?
Oh, okay. I'm Phil, I don't know who I am. I'm Phil Schneider. I chair this committee and I'm on the county board.
John Moore, I'm on the county board also.
Mary Schneider, I'm a public member of the board.
Tom Hanson, County Board from the Village of Bruce.
Mark Schmidt, a citizen member.
We have 2 on vacation and 2 open slots, so that's why we look a little scant.
It's nice to meet all of you because it's nice to be able to put a face with the name when you hear them. So I appreciate being invited down.
Do you have any questions for us?
I don't think so.
You can head back upstairs if you want to.
I don't particularly enjoy large groups of people, but okay. Thank you.
Fantastic.
Thank you for inviting me down.
Thanks, Amy. We'll jump back to the budget. So, like I said, the one that I'm concerned about at this point in time, 6 months in, is our adult services budget. It's on page 11. We are projected to go over. Probably not gonna get any better. That's kind of where we're at. Everything else, I think, is fine. But it is the placements and the mental health crisis that keep happening.
Changes at the federal level, I think it's gonna really impact that. Fortunately.
Has the state given you any idea how that bill is gonna affect us?
Anybody have any questions with the budget sheets?
Yeah, on that one for 23 and 24, expenditures and revenues equal out, kind of a balanced budget. But not the case this year.
Well, they kind of just. Laura just, that's how she put it in, was just even them out for that. But. I'm not quite sure how she figures that out. She's the magic numbers person. But unless she just breaks them even, left them alone, but
But there was a cushion built in there somewhere.
that's what I hear. But yeah,
Then cut down and down.
Right.
Originally, it was what, 200,000 at one time?
I think back when I started, it was 200, maybe a little more, but
yeah.
We just put it in there because of things like this, you know, and then just carried it forward year after year, so.
And so I'm gonna jump ahead a little bit, maybe not, but we have to, I have to come back in August and present our budget. You guys are ready for 2026. So this next month, Laura and Brittany and I will really be sitting down to talk about our budget because we have to present to you guys. I guess that was the ask of us at the department head meeting on Tuesday, was that we have our budget, proposed budget ready to go in August. And really be drilling down on that. So next month is really gonna be budget focused.
Yeah.
And then if,
need a motion and a second to approve those.
Turn on the budget report. Is there a second?
Second.
Discussion. Favor, say aye. Carried. Fine.
you actually don't have to sign them anymore when I submit, I just have to, they changed
Okay.
that, last month, it's just. I just need to sign it, but we need to show it in the minutes that
Yeah,
it was approved, so. I don't remember if it was last month or the month before, but I came down with a request to apply for the foster care grant. I'm just coming back to let you know that we were approved for $5,794. So that will be used to support our foster families. So just letting you know that we were awarded that grant. Yeah, it's helpful. Our vacant position right now. Every time I say that we're fully staffed, which I made the mistake of saying on Tuesday at the department head meeting. That's not cool. But we had somebody give notice this week in our CCS department. So next month I will be coming back with a request to fill form for that position in CCS. We have one person starting in children's long-term support on Tuesday, so next week. The child protection unit is fully staffed. But we are short one person in the ADRC right now. I do have that request to fill form here today for your approval. So when Fawn left, it was approved to recruit for the elder benefit specialist. We ran that recruitment. After I got approval to recruit for that position from this committee and personnel, the day after, an internal candidate said that they were interested. That internal candidate applied, was offered the job, and has now accepted the job. So now we have that internal candidate's position open. Lisa. So that's what I'm here today to ask, is that we request to fill the disability benefit specialist position that Lisa had, because she moved over to the elder benefit specialist.
So isn't there an easier way, like if an internal moves over, we should automatically have pre-approval
I
to?
don't think that is my decision, Mary.
Because otherwise we're dragging behind.
I don't disagree.
Well,
I don't disagree, but
I think that should be looked at, when it's an internal move and then automatically opens another spot that's already been approved to be there. That should go somewhere.
it's been discussed, but some people are putting their heels in, because before Jeremy would just call me and say, can I go for it? We'll prove it at the meeting. It worked good, saved a month.
Well, right, because if something happens tomorrow, now we're in August 14th.
Right. And you might miss the opportunity, like if somebody's out there looking.
Yeah.
There's certain times of the year that.
well, like our CCS person put a notice on Monday or Tuesday. So this packet, everything was already done. So now I'm gonna wait until next month to, all the appropriate channels. So that's my ask today, is to be able to move forward with the request to fill vacancy form for the disability benefit specialist. And personnel is today at 3. We'll do that at 3.
Well, I hear a motion on that. I'll ask, when are we gonna go for the CLTS person?
Want to give the new person starting a little bit of time to get into the role, or I throw 2 brand new people in there.
Okay, well, I'm just asking.
Yeah, I don't have a time frame, but I don't want to throw 2 brand new people in, because it is a lot to learn. And they have to do training, like functional screen training and
Okay,
learning the manual. It's a big job. It's a lot to learn, and I don't want to put the burden of 2 brand new people on Brittany and Michelle.
well, you're in charge, 'cause we don't know those things.
Yeah, no, I'm gonna wait a little bit.
Okay,
Once that third worker gets going a little bit, then I'll come back and ask for that.
motion on the request? Motion to approve.
Second.
Discussion. All in favor, say aye.
I-
Opposed, carried.
We're going right through Melissa. The last thing on the human services tab here is the update on the citizen member. We did have 2 applicants put in their letter of interest. However, when I asked when they would be appointed, it was said that we kind of have to wait until committee on committee meets, and they're waiting on letters of interest for District 6 and District 8. So I don't know if they typically can do them separately, or if historically we just wait for board members. I don't know, but that's what I was told, was they're waiting for letters of interest from District 6 and 8 to maybe do a meeting all together. But we do have 2 letters of interest, 2 applicants, essentially waiting
One of the.
for the No, for the citizen member.
Oh, okay, oh, for here, okay.
Yeah, for here. So we do, and they were both very good candidates. I think either one of them would be a great addition to this committee. It's just ever they get appointed, I guess.
Okay.
Public health updates, and Kaylee must not have had any. Oh, but that's okay. I think generally she's probably just gonna talk about those new programs that they're gonna be offering, the babysitting class and the CPR instructor class that Amanda's gonna be doing. And the mental health first aid that Kaylee is going to be teaching. Which is really, really great. I think we did that a couple of years ago with law enforcement. Had somebody come in and train us on that. And then in the packet, there's some program reports for adult services, child support, public health, and the ADRC. I just want to highlight for our adult services, as I'm talking about their budget as being one of concern. Presently, we have more chapters this year in 6 months than we did the total for 2024. So we're already over the amount of people that were chaptered in 2024. So I don't know what is going on. However, it's not looking good for that, just because of all the mental health crisis that are happening in all the placements and people going to the hospitals. And Chris and Bethany are both indicating that these are not individuals that have like been on their radar. A lot of them are just new people coming forward with mental health crisis.
Are they people that have just moved to our area too, or
There's a couple
because
that
they're
are
kind of
in the area.
invite their friends sometimes.
But I just wanted to give you guys that update, was that we are already over our chapters for 2024 this year in 6 months. So
Are we seeing an increase in like more drug problems associated with the mental health, or?
haven't been discussing like it is drug related. Most of these people are going to Winnebago because of the full necklace that is closer. What else do I have? So last week, I mean, I don't have a lot of information on it yet. I just kind of got a update, but the 2025-27 state budget that went through last week. Just a couple things that will impact health and human services. For child welfare, they approved a 2.5 increase for foster care and kinship care. And then they will add funds to the children and family aids for the cost of that increase, which I guess is good. Foster parents will get paid more. And there was a change to childcare licensing. They're going to allow larger staff ratios for infant and toddlers, and for family childcare centers to serve up to 12 children and persons age 16 to be assistant childcare teachers. So that should help opening that up a little bit, because I know finding childcare is difficult. Finding employees to work in childcare facilities is difficult. And then there's going to be increased base funding for ADRCs by 2.5 million, all funds annually effective 1/26, which is about a 5% increase in base ADRC funding. So that is a positive too. That, and then I have just like a community update, I guess. And some of you may or may not have seen this already or heard about it, but the Lighthouse did send out an email. I think maybe yesterday, the day before, I can't remember. But they are talking about closing the women's shelter. They're temporary closing the women's shelter. It sounds like there's a problem with their well or their septic. So that's gonna hurt. And right now everybody is in the men's shelter. So she said that there is one, I can forward you this letter too. But it sounds like there's one family 2 women and then 2 men, all at the 2 single men, 2 single women, and 1 family of 4, all at the men's shelter right now because the women's shelter has been temporarily closed. So that will hurt, but just for those who really need that resource.
Who owns those buildings?
It looks like the Flambeau mine.
It's that one on top of the hill.
No, because I'm saying, because there is help for sewer and wells in zoning and land and water. But it sort of depends on, I don't know what the regulations are, not your own, but there is help. Some help.
But that's where that is right now. The women's shelter is
So they'll
closed.
have to
So just
check into it and find out.
a side note, Gunderson Health System in La Crosse added 4 beds to their inpatient behavioral health. And there's a new place opening up in Madison. It's called Acadia Healthcare is opening 120 bed psychiatric hospital in Madison.
That's
They're gonna initially start with 30 beds and plan to add additional. So
far away.
Yeah.
I know,
Far away.
Emery, I don't know how many Emery has, but we do use them a little bit.
And you have to,
didn't they close down part of their,
I don't know, I know we've,
I don't know,
a
but
couple of our.
they do take a
chapters
couple every once in a while, but I think their restrictions are just.
I think their, wasn't it their high acuity dementia unit they
Yeah.
shut down?
Maybe.
Which that really hurt too, so. Does Rhinelander do much anymore?
I think we still send some every once in a while if they have beds
Yeah,
available.
not,
Yeah. They don't have
But I
it.
think they're frequently full is the problem. Which is why we've been ending up going to Winnebago.
And somebody was talking about reopening Ellie Phillips,
Been talking about that too.
but I don't know where they're at with that.
Well, they've been talking about that for Lutheran Social Services, I think made an announcement 6 months ago.
Yeah,
And they still haven't opened it, so, but they did get some state funding, I think $1.2 million or something like that. So that should speed the process up, I would think.
Something about it. It's okay.
If they got it or if it's in the bill or the bill or.
So, yeah, I thought Jesse James was on TV the other night saying that it was,
It's pretty good for our area for certain things.
So this update for behavioral health says $1 million in 26 for renovation of a substance use treatment center in Chippewa Falls. The funds are earmarked to LSS.
so they must be,
26.
they probably have to bring in the code.
well, that's, yeah, that starts July 1, right? I suspect it's got,
Yeah. Cause once you shut it down, then you have to bring it up to 25 and not 96 or whatever.
I guess we're gonna have to hang out for 5 minutes.
Mm-hmm.
And just a reminder, next month, I'm going to start in-person program updates. So I'll have the supervisors come down and give an update on their program. So every other month, we'll rotate for 1 month and then 3. Get through all 7 departments. So
We still have nobody call in, right? You guys, I just thought about that might be kind of confusing because the county policy is you can't talk if you're on video, but since this is an open meeting, we'd have to allow them to talk, so.
those are my updates. Does anybody have any questions for me? Or feedback on how the public presentation went? Like I said, I have no idea how it's really supposed to be presented because there's really no guidance, so I'm just winging it. So if you have suggestions, okay, like if you have suggestions, I will absolutely take them.
I do hope that Ashley will get us in the county board slot sometime. I mean, like I said, I was really surprised that didn't get much discussion
Mm-hmm.
and it went through.
Yeah.
So let's give them a little more information.
So the PowerPoint you're saying
Yeah.
to full county board? Okay.
Yeah, I think that'd be a good idea.
hopefully it's at a meeting where the agenda's not overloaded already.
Yeah.
proposed one I saw, let's week, but. New person.
Technically, because Rich moved up to the supervisor position, he took his youth position. Kind of, yeah, she slid into Rich's. Rich was promoted.
Program always sort of seemed to be so much infighting on it. The years between all the people involved, departments and everything. Yeah. Hopefully we can, because then they give us a paper with what we're doing, but we're doing, you know.
Just a lot of behind the scenes stuff, like, so when they
But
get,
I mean, the ones that pass and graduate. Sure, there is a lot of back stuff on it.
I'm not sure why the committee gets involved with a citizen member on the board.
Or did before.
I mean, that doesn't seem to make much sense because it's,
no idea, that's what I was.
I mean, they have to, I know the board has to approve the appointments and stuff, but why it has to go with many committees, I don't understand.
And I don't know who's, like, so you have two people apply basically for one spot. I don't know whose responsibility it is to, do you interview? Do you,
Committee on committees.
they do that too?
Maybe that's why they have to, maybe that's why they're involved, is because there's two and they have to essentially interview both.
They had to appoint you, didn't, you had to get reappointed, right, Mary?
Yeah.
So
But nobody talked to me.
there's only one and you were already
I
on?
was gonna say maybe it was because there was,
Yeah, I don't know how
I
that.
actually was off for a month because my term had ended.
Yeah.
They never contacted me. I just heard through the grapevine that I needed to come back.
well, thank you for coming back, Mary.
They just took it for granted here.
Mark, your name will be on next month. I emailed. Finance. Next meeting is August 14th.
Is that during the fair or after, is it the week after the fair?
Might be right in the middle of it, I don't know.
That one's the fair the second weekend and so that would be after.
So I think,
After the fair.
okay, good. It's like my kids are showing pigs on the 7th, so. I was like hoping it's not the same.
We'll just all meet out there.
But at the fair, it's fine. Let me know when I need to go to the board and I'll bring my PowerPoint.
That'll be probably Ashley's moves. So. And once again, you know, since we sort of got caught in a stumbling block, if you're not gonna make the meeting, please get hold of Ashley or the front desk and tell them, so we don't have this right down to the wire to find out that you're not coming. Otherwise, we'll assume you'll be here or send the officers out for you.
There you go.
So yeah, so today I'll go to personnel for the request to fill form for the disability benefit specialist at 3.
Oh, I'm supposed to check, we got recommended.
Revoked. Thank.
Well, does anybody have anything else? No? Well, thanks for coming and we're adjourned.
We need a motion in order to close public session.
Think we can do well.
Yeah, thanks.
Was the open meeting or?
Motion to close the public hearing.
I'll make a motion to close.
One second.
Discussion. All in favor, say aye.
Aye.
Very. Can I close the meeting now, Carl?
Thank you, everybody.
Yeah.